normally call it an orthopedic massage with our integrated body work, because I integrate, and my employees, we integrate stretching, SMRT, which is spontaneous muscle release technique, orthopedic techniques, skeletal techniques that we just went to a workshop with Eric Dalton, and he is fantastic too. And we kind of already were doing those because Eric Dalton and James Wisłowski are so similar that when we went to that workshop last June, we're like, oh, we already know how to do this. We felt like we were ahead of the class. And there was like 250 people in this class. Wow. It was a huge class. Wow. So we were already kind of doing those. But when we do like a clinical / orthopedic massage, again, we can either start face up or supine, face down, prone, or on their side, just depending on what's happening in the body. Again, we start at the hips, we release the chest, anything. We tend to release anterior muscles before we release posterior muscles, or we go after the source versus the symptom. And more often than not, we work the symptom very, very small, very, very short. I know it's not satisfying for them, like mentally, like they just want you to put their elbow in there, kind of squeeze it, but it doesn't work. And it's going to feel great for about 2 or 3 hours, and then the pain is going to start coming back. And that's the difference between a basic Swedish massage and a clinical or orthopedic massage. I like to call it orthopedic, except for the 20-minute sessions. I like to call those clinical because I'm trying to treat them as quickly as, say, a chiropractic visit, or when we go out and do events and we do 10 or 20-minute stretches. That's what we're trying to do, but with massage.
Right.
Yeah.
Kind of reminds me of like in PT, a lot of people are like, I have knee pain, and we're like, that's a symptom. So, but we're going to work on your ankles or your hips.
Yes.
And then finding the cause and then fixing the actual issue to your symptom.
Yes.
Right. Because rarely does the symptom is actually the source of the problem, So would you, at any point, and the reason that I'm asking these questions, because I think a lot of people probably have misconceptions about massage therapy, right? Or massage therapists or anything like that.
Absolutely.
And so is there at any time where you would recommend someone and just be like, just go get, like, I guess, a Swedish massage, right?